Hi, welcome to School Staff Asthma Training. If a parent or guardian reports that there's been a recent history of asthma for a student, an asthma action plan is completed by the parent and guardian. This plan will include the triggers of asthma, symptoms the child typically exhibits during an asthma attack, and medication the student takes at home for asthma, and quick-acting medication that the student may have available at school. Elementary students will usually have the rescue asthma medication kept in the nurse's office, and middle school and high school students usually self-carry the rescue asthma medication if they have proper permission forms on file in the health office. Asthma is characterized by airway inflammation, airway hyperresponsiveness, and airway obstruction. Breathing difficulty results from changes in the air passages of the lungs. Inner walls of the airway swell, muscles of the airway walls tighten and constrict, and swollen walls produce excess mucus which clogs the airways. Factors that may trigger asthma include respiratory infections and colds, allergic reactions to pollen, mold, animal dander, dust, food, vigorous exercise, exposure to cold air, or sudden temperature changes, air pollution, fumes, strong odors, smoke, excitement, and stress. Asthma students may have one or more of these triggers that set off an asthma episode. The asthma plan should outline their known triggers. Exercise may be a trigger of some children with asthma. Some additional things that can be done with exercise-induced asthma is to have the student warm up 6 to 10 minutes before exercising, limit outdoor activity when air polymer pollution levels are forecasted high or temperatures are of concern, and encourage the student to be proactive by using their pre-medication if prescribed in that way for their asthma or during an asthma episode while exercising. Asthma management in the classroom, keep calm and relaxed. Help the students sit in a comfortable position with their shoulders relaxed. Leaning forward with elbows on knees may be helpful. Talk with the child reassuringly. If there is a trigger causing the episode, remove them from the trigger if possible. If there's an asthma action plan for the student, follow the steps prescribed. Ask the nurse if you've not received a plan. Encourage the child to take appropriate medicine that the doctor's prescribed. And if the medication does not appear to be working effectively, notify the nurse or assist the child to the health office. Some children will have their inhalers with them, and some may not have medication at school at all. Common symptoms of an asthma episode are wheezing, tightness or pain in the chest, coughing throughout the day, difficulty breathing and shortness of breath, little energy for active play. More serious symptoms that may be signals that you need quick medical attention if the child's wheeze, cough, or shortness of breath worsens, even after the medicine has been given. Most medicines for asthma will produce an effect within 5 to 10 minutes. The child feels uncomfortable and is having trouble breathing, but you don't hear any wheezing sound. This may still indicate extreme bronchial distress. The child's chest and neck are pulled or sucked in with each breath. The child has trouble walking or talking, can't resume activity. The child's lips or fingernails are gray or blue. If the last two signs happen, get emergency help quickly. Other things that you can do as a school staff: try to keep the classroom as trigger-free as possible, encourage children to be as active as possible, follow the child's asthma action plan. If you notice that the student is inattentive or is experiencing hyperactive asthma symptoms, changes may be needed in medication management. Talk with the nurse and parent. Allow a student to engage in quiet activity if recovering from an asthma episode. And students with asthma may experience absences, so allow extra time for this. Let's watch how to use an inhaler.
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler one time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
Now let's watch how to use an inhaler with a spacer. The younger students will usually be prescribed a spacer to help them take their metered dose inhaler.
Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler one time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly.
Thank you. And if you have any questions about your students with asthma or symptoms they're exhibiting, please forward those to your building nurse. Thank you.